Hello everyone, welcome to my channel Physio Sala. So I had already uploaded the introductory part of electrotherapy and already completed the types of frequency of current on the basis of frequency. And the first frequency is to be low frequency current. So let's discuss about that. What is low frequency current and how you write the 2 marks question in university examination in electrotherapy. So it is electrical current with frequency is to be low. Already we have know about that. The frequency is to be 0 to 100 hertz and typically for the nerve stimulation and the pain relief or superficial pain relief. The frequency range is to be 0 to 100 hertz, and the primary effect into the body is to be muscle and nerve stimulation and muscle re-education. So basically, in clinical practice and in hospital, the patient have to become in acute pain and like superficial pain, and their pain is to be like in the NPRS scale is to be 2, 3, 4, and 5. We are used for the low frequency current, and patient have to be like paralyzed, and the muscle is to be hemiparesis. So there is inactive to perform the functional or movement like isometric isotonic. So we are taking the low frequency current as galvanic or either Faraday. So primary effect of low frequency current is to be muscle and nerve stimulation. So basic work is to be low frequency current is to be muscle and nerve stimulation to facilitate the movement of the particular muscles and particular joint. So what is the therapeutic application of the low frequency current is to be stimulate to improve strength of the muscle, relieve the pain, and also the promote relaxation into the body. So that is the basic work. Also the primary relieving pain to stimulate sensory nerve. If patient have come to you in your clinic and hospital, and if patient have complaining you are the pain, so we are applying the low frequency current as a TENS modality. Improve circulation and relieve edema. So muscle contraction is to be there. Like if take one example, if patient is coming with edema or like paralysis or hemiparesis, their circulation is to be stopped because muscle is not activate. There is calf muscle. Take one example. The calf muscle is not activate or facilitate. So the gravity is pulled down into the blood into the downward, and against gravity, the circulation is to be not effective because the muscle is hemiparesis or paralysis. So on that time, we are using the galvanic or Faraday current to stimulate the muscle or nerves or facilitate the movement and muscle re-education or improve the circulation. The types of low frequency current, there are 5 types of low frequency current. Let's discuss one by one. And after the next video, we have discussed one by one in detail video. So first one is Faraday current. It is a short duration interrupted direct current. We are using for the innervated muscles or nerves. What is the meaning of innervated? A muscle where the supplying any kind of nerve, the sensory nerves or like motor nerve. So there is any kind of injury or like cut. So muscle activity of the sensory is to be somehow is to be activated or somehow not activated, like paresis. So on that time, we are using the Faraday current to send the stimulation to the further muscle fiber or nerve to activate the further muscle to perform the movement. They have to be forget about that. Next is to be galvanic current. We are using the direct current used for the stimulating the denervated muscle. So what is the meaning of denervated muscle? So if any kind of injury or any kind of like cut, there is to be complete differentiate the one nerves into other nerve. So the further movement is to be not perform the hand. Like this is the nerve and there is a connection is to be cut down. So the sensory and motor function is to be forget about the further muscles and further limb or any muscle. So on that time, we are taking the galvanic current to facilitate send the signal and improve the muscle coordination or strength over there. So that is the meaning of denervation. Next is to be type is to be sinusoidal current. What is sinusoidal current? Alternating current produce a mechanical effect potentially with deeper penetration. So on that time, the sinusoidal current is less used in clinical practice, but their effective is very useful because it will be deep penetration will be occur. On that time, on the responding of the TENS, we are using the TENS of rather than using the sinusoidal current. So that is also come under the low frequency current. So it is important for that. Next is to be diadynamic current. Why it is name of the diadynamic current? It's so 2 types of function. First is pain relief, and second one is sensory stimulation for the nerve fiber. So that is the name of the diadynamic current. Next is to be TENS, transcutaneous electrical nerve stimulation. Their name is behind the introduction. So transcutaneous, that in the trans level of epidermis, there is a nerve fiber. If any kind of radiating pain, we are applying the TENS or localized or generalized pain of superficial. So we are using the TENS machine over there. It is widely used for technique that employ low frequency current to for modulated pain. So if pain is modulated or like sensory, if superficially pain like sciatica condition, so we are using the transcutaneous electrical nerve stimulation for relieve the pain for stimulating the nerve fibers, and it is based on pain gate theory I had uploaded on my YouTube channel. You can saw the videos. So that is the type of low frequency current. You can write university examination for 2 marks question. Thank you. Make sure you have make a diagram at the end for the good marks.